Hello, everybody. Excited to be with you guys today on another busy Monday morning. So thanks for taking maybe a little bit of a lunch break with me today and joining me for Learn with Lo. So if it's your first time here, welcome. With these Learn with Lo Monday videos, I really like to jump into more of our long form content where we can dig in deeper than maybe just like a simple Instagram post or a little Facebook post, because a lot of what I enjoy doing and what you'll hear a lot about on my platform, and it's what I've built my entire practice and business around, is really challenging our current medical paradigm around healthcare, right? Specifically around a lot of the chronic health conditions that we're seeing become more and more prevalent in our society because of a lot of lifestyle changes, nutritional changes, a lot of toxicities in our world, a lot of changes to our gut microbiome, right, which influences things like hormone balance. And I see so many individuals that go from practitioner, doctor to doctor, and just don't get the answers that they're looking for because of more of our algorithmic conventional medicine system. And that's just not getting people the results and success. So I'm here to build something different, people, right? And a lot of people I know are hungry for this information. They're looking for something like this where we're really taking outside of the superficial conventional medicine approach and we're digging in deep. We're talking about the root causes. We're talking about the why, not just the what behind disease. And so if you were with us last week, we got an opportunity to really talk about and dive into what I called the 3 most common misdiagnoses that I'm seeing right now in women's health. And by diving into those, we really had a chance to understand the body from a whole different level, a whole different conversation than a lot of people are getting more in a conventional medicine system, which then leads us to think about a little bit more of what are these principles behind root cause medicine, right? Because when we're starting to think differently, sometimes that can be incredibly overwhelming for people. Not only being a patient, because you almost feel like, oh my gosh, I'm like relearning my body all over again. Like I thought I kind of knew how my body worked, or how we kind of grow up thinking about medicine and caring for ourselves. And when you start to really flip it on its head, it's like, oh my gosh, like I'm feeling kind of overwhelmed. Like, where do I start, right? And so that's really what I want to dive into today, not only from a patient perspective, but specifically from a practitioner perspective, because as I get the opportunity to really learn and grow in my own practice, I have the opportunity to mentor other practitioners in this space as well too. And those individuals, we get to have some conversations about where do I start? How do I take on more of these complex client patients, more of these chronic symptoms and diseases that I'm seeing more and more? And I want to further that. I want to create more practitioners that are thinking like-minded to myself. So when it comes to more of those principles of root cause medicine, just so that we're on the same page, I want us to kind of think about what are those main pillars, right? I've boiled it down into six main pillars that I have really built the Lowdown brand off of, and how I have built my practice off of these 6 beliefs and principles about the human body, right? So we have to kind of start here first so we're all speaking the same language. So number 1, I believe in the healing power of nature. We have this innate healing wisdom of the body. It's built in. We just need to learn how to trust it, and we honestly just need to learn how to get out of its way. So number 1, we believe in the healing power of nature and the innate healing capacity of the human body. Number 2, we like to think about identifying and treating root causes. We're going to look beyond just the symptoms, and we're going to look for the source of the dysfunction, right? We also want to think about this opportunity to utilize the most low impact, or whatever, not low impact, low risk, high reward treatment strategies. So we're going to really look first to how are we going to reverse chronic disease, treat chronic conditions with food forward medicine, lifestyle changes, mind-body support to really realign with nothing but a positive domino effect and not just more side effects, right? That's what happens when we're looking at symptoms but not looking at the source. We just use these medications to kind of spot treat symptoms, but those symptoms, like we might resolve one symptom and create 5 new ones. It's like, that's not what we're about here, right? So the healing power of nature, identifying at the source, not at the symptom. We're going to be utilizing low barrier entry treatment strategies. We're also going to be thinking of our providers and our practitioners as our teacher, as our guide, right? It is not putting or giving away our power to someone or something else, right? That's not how it works. We want to make sure that we're educating as practitioners. We want to educate and empower patients to really take the driver's seat in their own healing process, right? So as a root cause practitioner, that's something that we really want to make sure that we're thinking about, is how we're treating the whole person, mental, emotional, and spiritual bodies, and we're focusing more on proactive care versus reactive care. So if everything that I just described there, with the innate healing capacity of the body, the knowing power of connecting with nature through food and lifestyle and mind-based medicine, treating the person from a whole integrative strategy versus just symptoms, but truly looking for the source, asking the questions of why I have what I have, not what I have what I have. If all of that registers with you, you are absolutely in the right place here. You are like me. You are one of those passionate believers in more of this type of healthcare. And know that by taking on that same passion, you're going to get the unique challenge of working with seemingly complex cases that I'm going to help you decipher today are not actually that complex at all. But some of the most seemingly complex cases that conventional medicine really doesn't have any answers for, right? And I'm talking about some of the chronic diseases that we're seeing increased incidence of, right? So you're going to get to really jump into the thick of some of these trends, like an increasing rate of autoimmune disease that we're seeing, right? Estimates say that we are increasing autoimmune disease rates at a clip of over 10% increase year over year, and over 80% of those being women. That is wild, right? Such a drastic increase in autoimmune disease prevalence. As more of a functional medicine provider, you're going to be someone that's going to also come to terms with the 54% of Americans that have metabolic disease of some sort. You're also going to get to really inhabit the world of increasing infertility rates. Up to 1 in 5 couples today, 1 in 5 couples struggle with unexplained infertility. We know in this space that it's not unexplained. There's probably a rhyme and a reason for it. The body is doing that for a reason. We just need to figure out what that reason is, right? So I just want you to know that if you, like I said, are a passionate believer in more of this root cause medicine healthcare like I am, and you're a fellow practitioner out there, we need all the help that we can get with these more complex cases. And unfortunately, I am seeing more and more functional providers that are feeling overwhelmed with patients coming in with so many symptoms. They don't really even know how to start or how to effectively manage a treatment program for them, which leads to a lot of conversations around things like imposter syndrome. People feeling like they don't belong in this space, or they can't handle this space, and also very high rates of burnout in this space. And trust me when I say that we need all of the brilliant minds that we can to help really combat and reverse some of these wild trends that we're seeing in the world of healthcare today. Like I mentioned, the increasing rates of autoimmune disease, metabolic disease, infertility, right? These things are not going away. They're just progressively getting worse because of our kind of standard American lifestyle and us understanding how far away we've gotten from even just being basic humans, right? And that's where I want for all of my fellow practitioners out there that are passionate about this space as I am, I want you to feel like you have confident systems and some surefire ways to create effective treatment programs. And that really starts with understanding your patient flow process. So talking about and getting into some of these low down methods today behind the scenes of some of my patient processes really came from some conversations I was having with some up and coming practitioners last week, where they were really talking about and a very real potential of embarking in this world of functional medicine and not really having, like I said, a pre-established system. And so feeling like they were kind of all over the place and looking for ways to get better client success, to reduce their risk of burnout, and also making sure that they have a effective thought process as they're trying to peel back the layers of these very complex disease patterns that we're starting to see out and about. So today, like I said, I think it can be dual-sided for sure as I kind of get into more of the juice and the meat of our content for today. I think it's going to be both-sided. I think my practitioners out there, absolutely this is going to be for you, because I want you to get a firsthand look behind the scenes at some of the successful patient flow and some of the successful patient processes that I take individuals through, no matter how simple or complex that individual's goals and conditions may look on paper, and as well as very, very informative for my patients out there that are seeking more root cause practitioner care, because this is going to help you identify and kind of like weed out and vet out as you're hate to say shopping around, but as you're kind of shopping around for your healthcare team in this world of kind of functional root cause medicine. It is the wild, wild west out there, people. I will be the first one to admit it, right? You could walk into 3 different offices who all call themselves a functional nutrition practitioner, and you're going to get 3 wildly different experiences, right? And that's because, like, to me, some people's training and confidence and their systems, like we'll talk about today, aren't quite up to snuff to handle more of these complex cases, and they get themselves in over their head, right? So as a practitioner, I want all practitioners in this space to grow and thrive, and I want all of us to be joining hands and working together to get our patients and client successes, because I certainly can't do it all by myself, right? So I want to teach other practitioners how to do this as well too, and feel really, really confident in their systems. And like I said, for patients to also get aligned to those practitioners that are doing great work in this space as well too. So today, I really want to share through and walk through behind the scenes what are the lowdown methods to getting your clients the same types of results without feeling overwhelmed by some of these more complex cases that we're really starting to see, whether that is more autoimmune disease, more metabolic disease, more infertility conditions, more complex gut conditions, and crazy food sensitivities, right? It's like there is a system and there's a process under there, and I'm going to help you guys start to see and formulate what this looks like behind the scenes for you. So let's just dive right into what these systems look like. So pillar number 1 that I would say has to start here, and I know this sounds broad, but we're going to kind of dive into what this looks like. Pillar number 1 of successful functional nutrition systems is going to be starting with a conversation. Conversation, Lauren, what the heck does that mean? It sounds simple, right? And I would agree that it does sound simple on paper, but you would be shocked to learn how many patient experiences with healthcare providers absolutely lack this step entirely, right? Talk to all sorts of individuals and different patients that I see on a daily basis. Talk to all of those individuals that are struggling with different symptoms and they're jumping from provider to provider. And they'll probably tell you that they maybe spent longer in the waiting room than they did with the actual practitioner for the appointment, right? That's a problem, right? It has to start with a conversation. So notice that I use the term conversation here very intentionally. This is not an interview. This is not an interrogation, right? This should feel like, what does it feel like to connect to this person in front of me, the patient that's in front of me? How do I connect with them as a human, right? Sounds wild, sounds so simple, right? It's allowing them to tell their story. This is very cathartic for a lot of people. So as a practitioner and a provider, I want to make sure that you're setting up your systems for a way that you can build this in, right? And it's not rushed and it's not skipped over, that you take the time to connect with the person sitting across from you. You take the time to really hear their story. And we'll talk about why this is so important in a second, not just for the patient, but how important this is for you as a provider. But it's also, I want you to think about understanding their lived experience in their body every day. That's the whole point of the conversation, is I want to put myself in their body and figure out what does it feel like to live in their body every day. That's where I'm going to get the most valuable information. I could run all of the fancy labs. I could do all of the fancy intake forms, and we're going to talk about that as well too. But if you don't know how to have a conversation with someone, how to put yourself in their lived experience, there's going to be so much key data that you miss out on as a practitioner, and it's absolutely going to impact your overall client success outcomes. 110%, right? Because there's certain things that you just can't get from an intake form or even from lab work, right? It has to come to a conversation. So it's so important that you set up your onboarding and patient flow process to allow for this. So there's lots of different ways this can look. So you could get the conversation piece of this onboarding done in maybe you do an initial discovery call. Usually it's anywhere maybe from 15 to 30 minutes. And a lot of practitioners will offer an initial discovery call where it could be a free call or it could be a small deposit that then the patient can apply towards future services of working together, right? Disclaimer, I will say that free calls notoriously have a high no-show rate. Just a little word of warning to my fellow practitioners out there, which is where the deposit can be super helpful for individuals to kind of show their commitment level, put a deposit down, know that they want to meet with you, they want to speak with you, they want to share their story, they want to get your opinion on kind of the best direction for them. So it could be you get the conversation in like a free or a small fee deposit discovery call. You could also have it built into your kind of initial consult process where it's part of a detailed intake form. Ideally, you would send this to the patient before the initial appointment that you guys have together. And I will say an effective intake form is key. This will help drastically streamline your initial consult appointment together so that you as a provider can come in prepared on what patterns stand out to you. So we want to make sure we ask them key questions, right? Ask them questions about who they've worked with in the past to help reach their goals, like other providers. Maybe they've worked with their OB or chiropractors, naturopaths, herbalists, who have you worked with to try to reach your health goals in the past? Ask them about their health history. This is huge. Pregnancies, birth stories, surgeries, other diagnoses that they might have. Ask them about their chief goals and their chief concerns and their current goals. Ask them about their current food choices, their current sleep habits, exercise habits, caffeine intake, stress levels, and also even asking them about current supplements and medications. So a very thorough intake form, which is something I help, like I said, practitioners that I'm mentoring come up with your specific intake form. Institute for Functional Medicine has a really great intake form that they allow you to share and kind of manipulate as well too. So they have a really great intake form that you can kind of take in and make your own as well too. And then I do think that a really helpful part of this kind of conversation or this initial data collection can be initial lab testing that does give blood work that the patient can actually complete before their initial appointment, or they can bring in some lab work that they've had from previous providers. I only say this because the lab work is, once you have that actual human conversation with someone, the lab work can be very helpful to help validate their lived experience, right? Because probably so often they've been to providers that, tell them like, oh, everything looks normal, everything's ship-shape here, but they definitely don't feel well. Or what really boggles my mind, and this is so wild to me, is how some practitioners will come in, mostly in more of the conventional space, they'll come in and you'll meet with them for an appointment and they draw labs at the appointment and then they say that they'll call you with the results. It's like 9 times out of 10, the people that I've talked to, no one ever calls them about the results. They're just uploaded into their portal and then they have to do like Google searching of anything that comes up. Or they have like a nurse that calls them and they're like, yep, everything looks ship-shape. Like, doctor doesn't have any follow-up for you at this time, or we can increase your anti-anxiety meds, or we can do whatever, right? It's like, we're not even running labs that we're covering together, like in person as part of that human experience. Like, that is so, so valuable. So when I say like pillar number 1, it starts with the conversation. It starts with the conversation of connecting to that person as a human, learning what it feels like to live in their body every day. And we can do that through discovery calls. We can do that through initial intake forms. We can do that through initial labs. But we really want to make sure that we're planning on probably 60 to 90 minutes for that initial consult process so that we can make sure that we hear their story and make sure that we really talk them through our thought process and our kind of plan of attack here. So pillar number 1 is have a conversation. Pillar number 2, now we're starting to get into some of the actual kind of practitioner-based skills here as well too. Become their medical detective is what I call pillar number 2. So you don't have to contrary to popular belief, practitioners, you don't have to have all the answers at the first session. Take a deep sigh of relief. Yay, I don't have to have all the answers at the first session. But a really key integral part of practicing root cause medicine is learning how to identify clues along the way, right? Things that they're telling you as far as symptoms, things that you're seeing in their intake form, things that you're seeing in their labs. Discuss with them all of the different trends that you're starting to piece together and how it connects. So maybe, like I said, you're seeing signs of blood sugar dysregulation. It's like you can validate for them. It's like, absolutely, you would have anxiousness and brain fog with this blood sugar picture. Or maybe you see signs of a sluggish thyroid and you're like, yeah, I definitely could see how you feel such extreme fatigue and some constipation patterns. Like this tracks, right? Or maybe someone's had multiple pregnancies and breastfeeding really close together and you're like, that is a perfect storm for nutrient deficiencies and microbiome imbalances. So like, I get it. And they're like, really? No one's ever told me that before. It's like, so start to piece together the clues, become their medical detective, because all you really need is just enough breadcrumbs to follow a trail. And then you just have to have a really strong starting point for that trail to begin piecing together their full healing journey. So if you're willing as a practitioner to have that conversation with the person and to become their medical detective, congratulations, you have already surpassed way more than 90% of the healthcare practitioners out there, even just by the first two pillars of this journey, right? Because you have the buy-in, you have their trust, you know that they know that you have their back here, right? You're starting to put some things together. So once, like I said, you have a conversation, we're becoming their medical detective. Pillar number 3, now start to put together a treatment plan, right? This is in alignment, must be in alignment with their body's innate healing capacity, right? Going back to like belief and principle number 1 of root cause medicine is we know that they have an innate healing capacity of their body. I like to teach this through something called the Hormone Hierarchy, right? It's something I use with my patients. It's something I use with my practitioners. It's time for us to take this web of different symptoms, web of their health history, all of the different clues that you're starting to collect here. And now this is where practitioners tend to get overwhelmed, right? Because they're like, where do I start? What do I go after first? What are some of the low-hanging fruit that this person can change first that's going to give them immediate relief? Or what are the small changes that will create the most ripple effect for this person? And so one of the most unique skills that I teach my mentorship students is how to determine and discern what to change first, not change everything all at the same time, but by doing this and understanding that you're going to filter this decision through something called the hormone hierarchy. It is rooted in science, right? This isn't just like, oh, where do I as a practitioner feel like starting? It's like, no, the body has a specific domino effect pattern in which it heals. We start from the foundations always. Always, always, always. I don't care if you're confident that like, oh, well, that person has the foundations in order. Probably not. We're going to start there, right? Or at least we're going to start there and they might progress through that foundations a little bit faster, and that's okay. So first we're going to be thinking about adrenal health and blood sugar balance. This could take 1, 2, or 10 sessions of our time. Doesn't matter. We're going to be talking about what I call the foundational 5. We're going to be talking about nutrition, hydration, circadian rhythm, stress management, and sleep, right? It's like, absolutely, we are starting there. No matter how fancy dancy this person thinks they want to get or what they think they're ready for, we have to start with the foundations first. Then, of course, if we even need it, then we're going to address things like gut imbalances and toxicities and pathways. Maybe this is where we bring in additional testing like a GI map, a wheat zoomer, an organic acids test, right? Maybe this is where we bring in more strategic supplemental protocols or more guided therapeutic diets for this individual. And then finally, if not already corrected through all the foundational 5 and the gut microbiome work, then we address hormonal imbalances. This is where we're going to maybe bring in things like a Dutch panel or toxin testing. This is where like pre or postmenopausal women might bring in something like hormone replacement therapy, right? I'm telling you, there is a specific healing order of operations, right? You don't just willy-nilly start at the top of the hormone hierarchy. It's like we have to start at the bottom. That is where the domino effect occurs. So whether you're a provider or you're a patient out there, like this order of operations system is key, right? That is where we reduce overwhelm as a provider and a practitioner, because we know exactly the order of operations that we're going to go through. Everybody may join that journey somewhere different along the way. Someone may progress through that journey a little bit different pacing along the way, but if we don't respect the hormone hierarchy and we're not healing in pace with the hormone hierarchy, all you're doing is band-aids. That's all you're doing. You're no different than a pill for every ill approach, right? And then pillar number 4 here, where I'll wrap us up, is finding your systems around ongoing support and guidance, right? So from there, it's all about the art of then learning, how do I inspire change through education? How do I understand that the patient is really the one in the driver's seat? You're just the passenger with a GPS system that's able to tell them, like, how do you get to your goals in the most efficient and effective way, right? So you need to develop your communication systems and your cadence, which again, this is something that I help my mentorship students do. But how often will you meet with your patients? Are you meeting with them weekly? Are you meeting with them monthly? How will you arrange your communication with patients between check-ins? Are you going to use a portal system? Are you going to use Voxer data? Are you going to use voice notes? How will the patient monitor data for you? Are they doing food journals? Are they doing wearable data, right? We always have to tailor the approach to each individual person, if we're really going to practice more of this root cause medicine care, right? So I really wanted to, like I said, whether you're a patient or you're a provider, I feel like there's some key gems in here that you can take home, because you're either from the patient perspective kind of vetting out different providers that might use this order of operations. It's like, are they having a conversation with me? Are they getting to know what it feels like to live in my body every day? Are they collecting labs before I even come in so that we have some data to talk about and kind of validate? And are they discussing the breadth of the treatment plan with me from kind of like start to finish, but also leaving wiggle room for how your body might respond along the way? And are they clearly communicating with me how they're going to guide me through that process, right? And as a practitioner, you can then be that person that's sitting in your driver's seat now and being like, okay, where are the holes? Where are the gaping holes where I'm leaking energy? And by leaking energy, you're going to be in a really prime place for burnout, right? So maybe that's your client onboarding process. Maybe that's your discovery call process. Maybe that's your treatment plan process, because you're just kind of poking and grabbing at whatever you can, but you don't have a systemized order of operations in which you take clients through, especially as cases get more and more complex. These are the types of things that I think are uber important for all of my providers to be able to know how to do, so that we can accept all of those great healing providers into the space, because Lord knows we need as many as we can possibly get. So be on the lookout for more information around some of my mentorship opportunities, because they're coming in 2025, which I'm super excited about. But as a patient or even as a provider, if you want to take yourself through my onboarding process, my functional wellness consult is open for I guess you could call it application. You can register for your functional wellness consult and literally see what that onboarding process looks like, at least from the start, to get an example of that as well too. So as a patient or as a provider, you're more than welcome to always go through that process, and you can find a link for that in my bio. So hopefully you guys, like I said, have an amazing week, and I'm excited for even more content coming your way next week.